And what we're here to talk about is our study for the associated risks of stillbirth. So our SOARS study, and I will pass it over to Danielle to talk a little bit more about what SOARS is and some of the data we have so far. Hi everyone, my name is Danielle Uribe. I am the data manager for Utah Programs and Utah SOARS. Anytime I get to talk about SOARS, I get really excited. Utah is, up until this year, one of the few states to have a SOARS survey. Ohio was the other for a while, and this year there's been some funding to some other states and cities are starting to look at implementing a SOARS, but it has been something that's been very special. It's coming to Utah that I've been getting to look at. And I really am going to try and provide a very brief overview of the SOARS survey and then just share some of our key findings related to provider supports and the experiences that families have within the hospital following the stillbirth. So what is SOARS, also known as the Study of Associated Risks of Stillbirth? If anybody's familiar with the PRAM survey or the Pregnancy Risk Assessment Monitoring System, it was based on that. And then just with some modifications to the survey questions, some of the methodology, as how the families are contacted, how many times they're contacted. We wanted to make sure that it was sensitive to families that have experienced a stillbirth. It was first established in 2016. It began in 2018 to be distributed, and it's been distributed ever since then. So it is sent to every Utah resident over the age of 15 that experiences a stillbirth. And the mailings begin about 2 to 4 months after the stillbirth occurs. It's usually closer to 2 or 3. And the only other really exclusion criteria that we have, we don't send a survey if the fetal death certificate is missing certain variables. Birth dates for the mom seems to be a common one. And then also if it was filed too late, that's very rare. I believe is a year that I've been here. It's happened one time that I've done one time to be included in the sample. And then we also perform an extra check before anything it's mailed to the family to make sure that the mother is still alive and that she hasn't passed away, so that we avoid sending a survey to a home that may have experienced, a fetal death and a maternal death. So all moms receive a necklace designed by a local Utah artist. And this is even if they choose not to participate, it's not an incentive. Every mom gets it, and it includes a card that explains the significance of the pendant. We do get a lot of comments on our survey specifically about the necklace and how much they appreciate it. And then some of the topics are about health prior to pregnancy, insurance status, any infections, complications, substance use, and intimate partner violence. And then we also asked about services offered during the hospital stay, level of support, and any testing that was done. So the purpose of this analysis was to determine the level of provider support felt by participants following their stillbirth, identify hospital services that were offered to families and how these services may influence feelings of support, and then also identify any maternal outcomes that may be influenced by having adequate provider support. Before I get into that, I do want to acknowledge there's been so much discussion about health equity and disparities today. I do want to just acknowledge why that type of research can be difficult in Utah just based on our demographics. So it shows for the time period that we have data for currently is 2018 to 2021. So white non-Hispanic mothers were 71% of live births and 74% of fetal deaths. So just based on the SOARS data that we have right now, we don't have enough to really stratify it by race and ethnicity. We should be getting 2 more years of data hopefully soon. And that's definitely one of our top priorities is to be able to do that work. It just gets really difficult when you have a population like Utah to do that sort of analysis. So for some overall results, for the data set that we have now until 2021, we had 520 responses. So the response rate of 54%, which for is really good for a survey like this. I think PRAMS usually shoots for 50%, so for us to be above that is really great. 86% of the fetal deaths occurred prior to delivery, maternal blood testing was the most commonly performed test, and a fetal autopsy was the least common at 22%. So when we asked about services that were offered, having the chance to hold their baby, receiving impressions, funeral resources, other mementos, and peer support resources, those were all offered to at least 90% of moms. And the least common services offered were visits with the religious leader, being able to bathe their baby, and a baptism. Those were offered to less than half of moms. So 46% of moms reported that they had attended grief counseling. Among those who did not attend grief counseling, the most common reason was that they just felt like they didn't need it. I will say it's not an option on the survey, but we get a lot of comments from moms saying that they may want it in the future, but they're just not ready for it right now. So when we do have the opportunity to update our survey, I think that would be one of my priorities is to include that because it seems like they're not finding the right answer. The least common reasons for not knowing where the groups were, financial concerns, and not having any groups near them. So in terms of provider supports, 87% felt like they were adequately supported by their doctor or midwife, 96% felt supported by their nursing staff, and 78% felt supported by their grief counseling staff. So for the rest of this presentation, just for the purposes of time, I'll be focusing on the doctor or midwife support specifically. So looking at selected maternal outcomes, postpartum health visits and seeking grief support were more common for moms who did report adequate support from their doctor or midwife. Interestingly, at least I thought it was interesting, the rate of autopsies was the same for both groups. So what I wanted to look at after that were the reasons why autopsies were not performed for those families. And I found that for those who did not feel supported, 27% of them listed a communication issue as the reason that they did not have it performed. Either they weren't asked, they felt like they didn't get enough information, or they weren't asked appropriately. They were just confused by the process, and that's why it wasn't done. And that was only 14% of those who did feel supported. And then other reasons that were listed, financial concerns, personal or religious reasons, and just not thinking it was needed. And from our perspective, our goal isn't to pressure families to making a decision that would go against their personal beliefs. We just want them to have all the information they need to make that decision, and to have that information communicated to them appropriately. So next, I wanted to look at hospital experiences that may have influenced whether or not they felt supported. So moms reported being given lactation information and instruction at higher rates than those who did not feel supported. We do have moms who say that they were not given any information or they weren't even aware that it was possible that they could have their breast milk come in after they left the hospital. So just having that counseling can be really helpful. And the biggest difference that I found was with moms who felt supported and their doctor discussing what may have happened to their baby with them. That was 55% who did not feel supported compared to 90% of moms who did feel supported. And again, that says what may have happened. It doesn't say what did happen or they know exactly what happened, because a lot of times they're not. But it's just taking the time to have that conversation that I think is really the key factor. And then looking at some of the services offered that I mentioned earlier. So some of the big differences that I saw were really offers of cooling beds, having those available, social worker visits, and like family photos being available. Those seem to be things that had a really big difference. But I believe the biggest one would be 70% of moms who didn't feel supported said that they had the chance to stay with their baby in the same room compared to 90% of moms who did feel supported. So that seemed to really make a difference. And then I did want to end just on some written comments from source participants. We have a back page like the PRAM survey. We did get a lot more comments than the PRAM survey. So I think two different participants who had two different hospital experiences. My hospital had amazing nurses that made all the difference, except for one. When she was there, it made things worse. She wouldn't touch the baby, and you could see she wasn't comfortable, making it worse. The hospital also was called to ask how breastfeeding is going, which is hurtful to see. It was just another patient that they didn't take notes or care for. And then compare that to another participant. They said I was treated with the highest amount of respect and care during my experience. I was provided a pro bono photographer. I had about 10 hours to spend time with my baby. We dressed her, took footprints, and took as much time as we needed with her. They held my baby after we left until the funeral home came to collect her body. So then brief discussion about our next steps. Really want to focus a lot on provider support. We have a really great steering committee, so hopefully that's something we continue doing work on. It is important to think about things like lactation education and how the information is being communicated with families. The importance of just having a cooling bed available, even if families decide that they don't want to use it, being able to room with their baby, and then just having the discussion about what might have happened. Once we do receive our 2022 and 2023 data, hopefully soon, we do plan to conduct a more thorough analysis of this. But I will say that the data that I shared today from 22 and 2021, it is available for analysis by anybody who's interested. So if you are interested, please feel free to reach out to me. I'd be more than happy to work on that with you. We can hopefully get some data requests going. And then the QR code will also take you to just more information about SOARs, and you can also view a full copy of the survey as well.
To both of you for speaking about SOARs, and I wonder if anybody has any questions.
Thank you very much for that. You had a response of 54%. Any information about what's the differences between the responders and non-responders?
So that's something that I'm just starting to look at. We're hoping to put together analysis
Area or even zip code or.
We found that overall, or at least I've looked mostly at race and ethnicity. So it is fairly representative. The one group that we see lower response rates from compared to the rest would be Native Hawaiian Pacific Islander. So that's one area we're looking at, but we're hoping to do something with our SOARs and our PRANS data. SOARs gets really tricky with the small numbers. So we're hoping that if we kind of look at them together, it would be a little bit easier to analyze.
Thank you for a really interesting session. So at the moment, what happens is a death is registered and then your department contacts about the survey. Is that how people find out about it? So do the clinical staff at the hospital give families a heads up that that's what is going to happen for every death in the state?
It used to be, yes.
Okay.
We when the survey first started, we partnered with Share Parents. They were very supportive of us. As the years went on and all of that, I think we lost that. I don't know if hospitals are still talking about it. The way our survey goes out is that it's not just a survey that's sent out very first. We do send out a condolence card saying you can expect the survey, and then about a week later they will receive the survey. We're really mindful of when that goes out. We try to avoid the big holidays, Mother's Day, Christmas, so they're not getting these reminders during kind of like maybe those heightened emotional times. So,
but it would be helpful, surely, wouldn't it, if everybody who experienced a loss was told that this is something that will happen and you can expect to be contacted in the next few months?
Yes, it would be helpful. And when we did start the survey back in 2018, I believe our response rates were around 80% because they were expecting that. Yes.
Thank you.
Any other questions? No. I just one for you guys. It's really striking the difference between the moms who felt supported and moms who didn't feel supported. It's quite different. So how does, maybe I should really answer this question, but how does data depart the SOARS survey and go into practice change? And maybe it's more of a question for our clinician friends, but
Since I've joined the team, I think the biggest thing has just been the steering committee. My steering committee is really amazing. And I know there's a lot of great work being done specifically on autopsies. So I'm hoping that is very closely related to provider support so that there is work that's going to be done on both fronts as well.
And speaking of the steering committee, I would like to extend the invitation for anybody who wants to join our steering committee to join our steering committee. We are picking it back up and trying to figure out best way to use source data. And we would diverse voices are much appreciated in those conversations.
okay, thank you very much.